Hemodynamic measurements in shock. Firstly, we are going to look at the hypovolemic shock. So here, firstly, we are looking at what is decreased. So there are many things decreased. That is, the right atrial pressure is decreased, as well as the pulmonary wedge pressure is decreased, and the cardiac index is also decreased. The systemic vascular resistance is decreased. It is not decreased. Systemic vascular resistance is increased. This is in case of hypovolemic shock. Whereas the others, such as the mixed venous oxygen saturation, this is decreased as well. So only thing which is increasing in the hypovolemic shock is the systemic vascular resistance. Next, we are moving on to the cardiogenic shock. So in case of the cardiogenic shock, the only thing that is increasing is the right atrial pressure. So here the right atrial pressure, it increases, as well as there's increase in the pulmonary capillary wedge pressure. Now, other things is that the increase in the systemic vascular resistance is also present. This was seen in case of the hypovolemic shock, as here also it is increasing. Next, we are going to look at the cardiac index. Cardiac index is decreasing, as well as the mixed venous oxygen saturation. This is also decreasing. So to sum up, the increasing factors are the right atrial pressure, the pulmonary capillary wedge pressure, as well as the systemic vascular resistance. Next, we are looking at the septic shock. In case of the septic shock, there is increase in the cardiac index. So till now there was no increase in cardiac index, but in case of septic shock, there is increase in cardiac index. Whereas what is decreasing? Before that, there's another thing increasing. Increase is in the mixed venous oxygen saturation. Venous oxygen saturation was not increased in the previous two, but now it is increased in septic shock. And the other decreasing factors include the right atrial pressure, includes the pulmonary capillary wedge pressure. It also includes the systemic vascular resistance.